All truths go through four phases. First, they are ignored. Then they are ridiculed. Then violently opposed. And then accepted as if always known. 2,500 years ago, mathematician and philosopher Pythagoras, known today for his brilliant theorem, declared that the world was round. He was viciously attacked for his idea. It would take another 2,000 years for scientists to propose that the Earth was round. 2,000 years after Pythagoras, another scientist named Copernicus placed the sun, rather than the Earth, at the center of the universe. He was considered a heretic. His writings remained forbidden reading by the Church for nearly 3 centuries. He was soon followed by Galileo, a supporter of Copernicus, who developed the telescope. But instead of receiving awards, he was threatened with torture. In fact, when his fellow scientists looked through the telescope and saw what Galileo had described, they accused him of bewitching them. He spent the rest of his life under house arrest. You think, but these were distant and primitive times, and now we all know better. But do we? About 360 years ago, Antony van Leeuwenhoek, considered the father of microbiology, invented the first microscope. Even with his established reputation with the Royal Medical Society as a reliable observer, didn't prevent his observations of microscopic life from being met with skepticism and open ridicule. 200 years ago, Dr. Ignace Semmelweis established a routine of washing his hands before delivering babies and conducting surgery. This simple procedure reduced the death rate by an amazing tenfold. Instead of receiving accolades, he was considered an embarrassment by his colleagues. He was tricked into entering an insane asylum where he was restrained against his will. He ended up dying alone in the asylum. Today, any doctor who doesn't wash his hands between patients is considered incompetent and negligent. You would think that in our advanced modern era, things would have changed. But have they? Only 30 years ago, Dr. Barry Marshall, an Australian physician and medical researcher, suggested that stomach ulcers were caused by bacteria, not stress and spicy food. Marshall's theory was dismissed by his community. Dr. Marshall finally infected himself by drinking a brew of Helicobacter pylori, then subsequently cured himself with antibiotics. However, the bacterial theory was still not accepted for many years, until it won him the Nobel Prize in 2005. Just over a decade ago, Dr. Rashid Buttor, an American physician, testified regarding the use of mercury in medicine and its association with autism and immunosuppression in cancer. He was brought up on false charges by the NC Medical Board for treating cancer patients with non-proven treatments. At the time of his testimony, a number of Dr. Buttor's stage 4 cancer patients, all of whom had been given less than 6 months to live, were between 3 and 8 years beyond their prognosis following his treatment. To that, the medical board's one-word response to Dr. Buttor's treatment result was irrelevant. In 2014, Dr. Mehmet Oz, an exceptional cardiothoracic surgeon, stated on national television that GMO products should be labeled so people have the choice. 10 physicians requested his dismissal from Columbia University, and he was prosecuted in front of the Senate Subcommittee on Consumer Protection. A private investigation would rather prove that 7 of the 10 physicians who requested his dismissal worked or had worked for the GMO industry. Yet, to this day, he has been ostracized by a large part of the medical community. These are only a few examples of how history treats those who want to help and heal the world. And there are hundreds of them struggling to effect changes and help advance science. Isn't it time we ask ourselves, why must so many have to suffer unnecessarily? And why do so many continue to suffer today?